Thanks so much, Philip. I appreciate the introduction, and I'm very happy to be here today. This is a topic that's really near and dear to my heart, and it's a hard topic to talk about. It's tragic to think about losing people to suicide, but I hope that what people take away from this talk is that there is a lot that we can do, and there's a lot that we really need to do. So I'm looking forward to the conversation. I feel like I should preface this a little bit by explaining to people how I got interested in this topic. Deans of social work, suicide and farmers, sometimes people don't see the connection there at all. And really, the way it happened was that my colleague, who's the dean of the College of Agriculture here, Sam Pardue, came to me one day looking shaken and asked if I had seen the CDC report that talked about the high rates of suicide in farmers. And I hadn't. And he sent me the article, and I was looking at it, and he said, what do we know about what's going on in Georgia? What can we do? And I had known from prior work about a CDC database that could be helpful. And that's how we started in the conversation. But we've brought in extension, we've brought in people from local communities. So we're having an extensive conversation about this topic, but it all started fairly serendipitously. So let me start by talking a little bit about the background. And as I mentioned, the CDC study revealed farming, fishing, and forestry as the third highest suicide rate of any occupation. Similarly, in Georgia, the rate was significantly elevated. And Georgia's a very rural state, so this is something that we were looking at. So what was happening? I was trying to wrap my head around this and conceptualize it. And the way that I think is most helpful to think about both the risks involved to farmers and also how we target help is to use a social ecological framework, which thinks about the individual as being nested within their interpersonal relationships, and that all of that is nested within their community, the local environment, and that all of that is nested within the larger society and larger scale issues. So, for example, we would think about the individual farmer and what stressors that person is experiencing, and think about treatment that could possibly address the underlying issues and build up coping and resilience. At the interpersonal level, we could think about family relationships and think about helping to resolve issues and educating families and strengthening them in ways to support farmers. In the local environment, we could think about rural culture and the community and farming community and others in the community that could be providing support. And then at the larger scale, we think about things like stigma about admitting that you have a mental health problem. We think about policies. We think about sort of larger macro structures. So all of those levels have protections that you can put in and also have risks that we need to identify. So I'd like to spend a little time talking about what prior research has shown in each of these levels, because I think it helps inform the conversation. So at the individual level, we've seen a number of things. There is some research that shows that depression may be elevated in farmers. This is not consistently shown, but it is something that is seen sometimes in the literature. We also know that this population is a group of folks who farming is hard on your body. So you end up with health challenges, injuries can be high. It's a very physically demanding kind of job. There's also been a lot of talk about farmer stress, and clearly stress can lead to other emotional conditions which can lead to somebody thinking of suicide. The demographic risk factors, when you think about age and gender, in terms of people who die by suicide, one of the higher risk groups is men, and older men particularly. And if you look at the demographics of farmers in the United States, that's who we're talking about quite frequently. And then there's this issue called challenges to identity. And what that means is that as a farmer, most people think of themselves as strong and resilient and independent and self-sufficient. And, excuse me, during times where there may be struggles on the farm, the challenge to that identity can be very stressful to a farmer. So now beyond the individual level, we also have to think about interpersonal factors. And if you think about farming and rural life in general, it can be much more socially isolated than many other occupations. There's just not as many people around, and what that means then is the relationships that you do have, you're much more dependent on because there aren't as many of them, which makes you more vulnerable in those relationships, and particularly in couples. When a farmer, and most frequently, I don't want to generalize too much, but most frequently the dynamic is the husband and his wife. When there is stress, it impacts the couple. When one is stressed, the other is stressed, and it can sort of feed off of each other and become a very difficult situation. So there's lots of interpersonal factors that we need to think about also. And then there's local environmental factors. And one thing a lot of folks are writing about and talk about is the culture of rural communities and farming communities. And as I said before, this is a community that is very proud in its independence, it's self-sufficient, strong, resilient, and that's a really important piece of the cultural identity. So within that context, admitting that you're having emotional issues, that you're having stressors, that you're feeling depressed, is really hard to do because it goes against a cultural norm. Similarly, stigma in help seeking. In our society in general, we tend to stigmatize people with needing mental health supports. But in rural communities, that may be more, and some of that may be due to a lack of awareness, just understanding of mental health issues. And then in the local environment, there are also physical risk factors. One of the things we need to think about is the ease of access to firearms. And, you know, on a farm, people need guns for all sorts of reasons, but that means that guns are easily available. And they are, and you'll see a little later in the data that I show, they're a very common implement used in suicide. There's also some research that shows that pesticide exposure may be linked to depression in some cases. So again, that physical environment may be a risk for depression, which then can lead to risk of suicide. And then we know that in rural areas, there's simply a lack of adequate health and behavioral health services. And even with telemedicine coming in, the problems with broadband still mean that there can be a lack of adequate health and behavioral health services. So there are these challenges and risk factors at the environmental level, and then at the societal and large scale level are the things that I think you hear most frequently from farmers as stressors: the weather, things that you can't control. Here in Georgia, year before last, we had Hurricane Michael, which just destroyed a lot of the cotton, a lot of the pecans. It was really financially devastating for a number of people in South Georgia. Beyond that, there's fluctuations in crop prices that we have no control over. You look at what's been going on with soybeans for the past several years, that's a perfect example of it. There are changing regulations, changes in policy and legislation, tariffs, all of these big factors that farmers have no control over are also stressors. So thinking about all of those put together, you can see that there's a lot of different levels of stress that are impinging on the farmer. So that's context. And then going back to what I had said earlier about my conversation with the Dean of the College of Ag, our question was, what's happening in Georgia? And I think it's really interesting that there's been much more research done on this outside of the US than in the United States. And a lot of the literature comes from Australia Some comes from India, some from the UK and Canada, and there's some in the US, but not as much as in other places. But even within the US, patterns vary geographically, and findings are statistical. We're interviewing people who may have thought of suicide, but not completed a suicide. So our question was, can we find out what are the characteristics of farmers and agricultural workers who've died by suicide in Georgia, and what factors are associated with them? So what I was able to do through the CDC was get access to something called the Violent Death Reporting System. And a number of states keep this. Georgia is one of them. It keeps data on all homicides and suicides in the state per year, gathers data from all sorts of sources, death records, police report, coroner medical examiner reports, lots of different things, and has that together. And the thing that's important about this database is that it has narrative summaries of the police and the coroner reports. So we get a glimpse into the factors and the stories associated with the suicide. So I was able to get 10 years worth of suicide data for Georgia and pull out all the cases that contained any farming related word, look through them, and identify those where the person was a farmer or an agricultural worker. And I ended up with 137 cases. Some people have said, well, that doesn't sound like a lot. And of course, even one life lost is a tragedy. But we also have to remember that the literature suggests that for every death by suicide, there are 25 attempts. So you're thinking, so with that, you're looking at a lot of people who may have attempted suicide, a lot of people in a lot of pain that we need to reach out to and we need to be developing interventions for. So with these data, I was able to do some quantitative analysis and look at number of deaths per year and demographics, and then qualitative and analyze those narrative summaries and take a look at what those themes were. So here's the numbers and a trend line. And while the numbers are very small, so you have to be careful, you can see that the trend line is going up, which concerns us. So who were these people? Overwhelmingly male, 97% men, non-Hispanic white, 92% white. They were more often than not married, 60% were not married. They were more often than not someone with a high school education or less. And they were older, on average 53 years. So again, as I mentioned earlier, older white men are a high-risk demographic for suicide to begin with, and then you have a profession where that demographic is very prevalent. I also really wanted to know about the presence of substances, because quite frequently substance use or abuse can be associated with suicidal thoughts and behaviors. So we wanted to see if the toxicology report was available. Sadly, it was available in less than half of the cases had they bothered testing for toxicology. For the ones where they had, about 20% showed that substances were present, most frequently alcohol. So this is a place where we need more information. How did people die? As I mentioned earlier, guns. Over 77% of the people died by a gunshot wound, followed by hanging. So as we think about keeping people safe, thinking about what to do with guns with someone who may be at high risk of suicide is something that we need to be considering while still respecting everybody's right to and need to have a gun when doing farm work. So one of the things, again, I want to make as a caveat is that there was missing data in these reports, and we have to get better at collecting these data. But what did we find in terms of the factors and the thematic areas associated with suicide? I've highlighted a couple of them. First, the number one factor associated with these suicides were relationship issues, both conflict in relationships and loss of a relationship. The second one was health, which surprised me. I wasn't thinking about that as much. But if you think about farming and the physical demands, being healthy is really important to being a farmer, and losing one's health could be devastating and a risk factor for suicide. Finances were not mentioned as frequently, which also surprised me. I'll talk a little more about that later, but I think there's a caveat there in that at the time of death, people may not have been aware of the financial problems, and finances might underpin other situations. And then indication that the individual had a mental health problem. If you look, only of the cases where we had good data, less than 30% was there a mental health problem that had been identified. Clearly, people who engage in suicidal behavior are depressed. They're in a lot of pain, but it hadn't been picked up. So that's an area where we can do screening and more interventions. And then this other area down here I wanted to mention, suicidal signs. These are the indirect or even direct, but clues and hints that the person's contemplating suicide. Words and behaviors. People noticed that they had been depressed. So these were the big factors, and people may have had more than one of these factors associated with the suicides. So I want to give you some examples and have you hear a little bit of the stories to get a better sense of some of the things that were happening at a time that a farmer died by suicide. So one with relationship issues, here's an example of a conflict with a primary relationship. And the narrative said that the victim and his primary relationship were fighting about the victim's heavy drinking, again, substances, with the primary relationship wanting the victim to get help for his drinking. She stated that they cooked dinner and they were still fighting about his drinking, and then the victim said he would just go kill himself, walked off, and then she heard the gun go off. There were also examples of conflict with other family. And then loss, as I mentioned before. Losing a partner seemed to be something that was associated with suicide in a number of the cases. Like in this one, where the victim was upset because his primary relationship was placed in an out-of-state assisted living home, and that relationship was disrupted. Health struggles was another area I mentioned, and that seems to fall into about three categories. Chronic health problems and loss of functioning. Here's an example of someone who had multiple health problems and told his family he was tired of being a burden to them because of his need for help, that loss of independence. A new diagnosis of a devastating medical condition. The victim was agitated about his condition, started talking suicide after he had found out that he had cancer. And the other one was chronic pain. Farming wears on your body. So in this case, the decedent was depressed and voiced suicidal ideation because he was hurting so badly and didn't want to live anymore. So all of these different versions of health struggles seem to be associated with the suicide. And then there was the area of suicidal threats and signs that I mentioned. Sometimes they were clearly verbal or they were behavioral, prior suicide threats or suicide attempts. Sometimes they were more indirect behavioral or verbal clues. In this case, the victim showed a close family member where he kept all his important papers and his will the night prior to the incident. And with 20/20 hindsight, she looked back and thought, oh, I should have understood he was putting his affairs in order. And then there was this theme of families not knowing to take a threat seriously, because an individual had threatened to kill himself, but nobody took it seriously because he'd made similar threats in the past. And we saw that in several cases. And this is in no way to blame families, but just to say that we haven't given families good information so that they can recognize the red flags and know what to do. I wanted to talk about financial stress because while not common, it was there. Loss of job. Also, financial problems linked with health problems. The victim had had a heart attack 3 months prior. His wife had lost her job, there were big hospital bills, and in over a third of the cases, there were multiple factors like health and finances melding together. And I think that's really important because you can never just point to one thing and say that is why somebody died by suicide. There's always multiple factors, and it may be that finances were underpinning other problems like the health problems, but it just wasn't identified. So what does all of this mean? Clearly, health and this theme of the not being able to work, not being able to do, is a precipitant, or can be a precipitant. One of the things I think it's important to say is that these are factors associated with the suicide. We cannot say they are the causal factors. We're just looking at these patterns. But health and the inability to work can be a precipitant. Financial stress was less frequent than we expected, but you've got to remember that financial stress could underpin things. There were suicidal threats in 20% of the cases, and families did not act, did not know how to act, weren't able to act. Again, I don't want to engage in family blaming, but family got suicidal threats and suicidal signs that just weren't recognized. And then mental health problems were only noted in 29% of the cases, which means people are not getting identified and getting the mental health treatment so that the depression and the emotional pain that they're in can be addressed. So what do we do in the future? First, and it's not on this, well, here it is, it's on this slide, we need better information. One of the things I want to do is look at the data nationally. This is what's happening in Georgia, but we know that parts of the country are very different. What's happening in the Midwest? What's happening on the West Coast? We need to be looking at national data. We need to be gathering missing data, particularly related to missing data from the coroner and medical examiner reports. And I had the opportunity about 6 months ago to share this information with coroners and medical examiners in Georgia and to talk about the missing data. And they talked about a lot of things that are connected to the stigma of suicide and having a mental health problem. They said, you know, if I don't know absolutely that something is going on, I'm not going to write anything down. They talked a lot about wanting to spare families pain, and all of that is totally understandable and laudable, but we also need to understand what's happening so that we can design interventions. And I think from what we've seen here and from conversations that I've had subsequent to this study, there are some really important targets for intervention. If you think about the fact that health was so commonly associated with a person dying by suicide, well, that means that family doctors and rural health clinics are real points of contact and are also trusted providers in a farming community. And if we can help those agencies and those individuals know the red flags and know the warning signs, we could intervene and prevent a lot of tragedies. Same thing when we think about relationships and loss. Who are the people that farmers may be interacting with at times of relationship conflict and relationship loss? Preachers, faith leaders, the church has a tremendous role to play in all of this. Or divorce lawyers, if relationships are ending. Nursing homes and assisted living facilities, if a partner has to be placed in a nursing home, and funeral homes. Again, all of these are places where people can be given additional tools to be able to identify farmers who may be at risk and showing warning signs of suicide, and to know what to do to get them to help. So we need to know a lot more with this, but these are some places in the future. And then one thing that I think is really important that I didn't mention before is that we need not secondary data, but we need to hear the voices of the farmers and the farm communities. That's really important. These are numbers, and this is data that's been collected. This is other people speaking for. We need to hear the voices in the community. One of the people in the community that does hear those voices and that is a really trusted part of the community is an extension agent. So in part of our work, we've been partnering with Ag Extension through the College of Agriculture, given that Sam Pardue and I were the ones who sort of started this work here. And extension agents have been talking about this a lot. It's, I think, a really exciting move in Georgia. One of the extension leadership did a survey early in 2019 when we were starting this conversation and just asked extension agents, how comfortable are you addressing the issues of rural stress and mental health in your county? You know, can you have this conversation? And it was very clear that at the time, people were not real comfortable with this. So one of the things that's been real exciting is that we've been able to partner with our Department of Behavioral Health and have been doing mental health first aid trainings, which is a day-long training to understand mental health issues, be able to recognize warning signs, know how to make a referral. But we've been able to train a number of extension agents in mental health first aid as a way to have somebody on the front line, so to speak, who's more knowledgeable about this issue and who families can turn to and who can recognize signs and symptoms and really intervene and get someone to help. And then in order to try to get some more primary voices, one of the things that I did at the end of this year was the Georgia Farm Bureau was very kind, and they allowed me to come to their state convention and set up a booth and do a survey. And I want to pause for a minute and I want to tell you a little bit about the booth. There's not a slide on that, but I think it's something really important. As I said before, we here in social work, we've been partnering with agriculture and particularly with extension and with family and consumer sciences, which also does extension. And we have been pulling together resources to try and share in the farming communities. We've been sharing these resources framed as an issue of well-being, because physical health and mental health are totally connected. So taking care of your blood pressure and taking care of your stress are things you have to think about together. So at this booth, I was handing out all of these booklets with all of this information, but I also wanted to survey people and ask them, what do farm community members say about stress, about what's going on in their communities? So I did this survey over 2 days, and we got 118 people to very kindly fill out the survey for us. It was really interesting because while farmers are predominantly male, when people walked by the booth and it was a farmer and his partner, wife probably, he would say, oh, here, you fill it out. So we had more women responding than men. Again, predominantly white, predominantly non-Hispanic. So what did they say? Well, first, I wanted to know what people thought the stress level of farmers were in Georgia now, given that stress can be an underlying causative factor in depression, and we hear so much about farmer stress. But my data ended in 2017. How are people feeling now? So on a 1 to 5 point scale, what did people think the stress levels were? And they thought they were high, over 4. And that was pretty consistent. And then I wanted to know if people were experiencing this as getting worse. So compared to 1 year ago, I think that stress levels in Georgia farmers it came very close to high. So it was more than the same, it was getting worse, which reinforced what we thought, but we heard it directly from farmers. I also asked a question about, did people have the tools to help someone who was in stress? So we asked, how confident are you in knowing how to help somebody who have very high stress levels, maybe even to the point where they were thinking about suicide. And what you see is that 30-something% were pretty confident, but there's this big chunk of people, of well over 30%, a third of folks who are not confident at all that they know what to do. And then there's this sort of folks in the middle. So it's kind of a bell curve, but this concerns us because we want to make sure that farming communities know how to take care of each other. So clearly this is a place where we could be doing more work. I also wanted to know, given that there was this interesting dynamic with the women answering for the couple, do the responses vary by gender? So what do you think the stress levels in farmers were? When you pulled out the men, they were lower than the women. Men were saying less than high, and women were saying more than high, and that was statistically significant. And then acknowledging that stressors are higher than a year ago, again, women were higher, and men were less confident that they would know how to help, though that didn't reach statistical significance. So I think one of the things to think about when you think about farmer stress is that it's not just the farmer, it's also the farmer's partner. And there are women farmers as well, obviously, so I don't want to make a terrible generalization, but we need to be remembering women as well and engaging in intervention for them also. So the next thing I asked was, what do you see as the top 3 stressors for farmers in Georgia? And as you would expect, weather was number 1, overwhelmingly, and then finances, commodity prices, the cost of operating the farm, and policy. Government legislation, regulation, aid, those kinds of things. And if you think about it, those are all things farmers have no control over. So of course they're the most stressful things. And one of the things we have to tell farmers is while you have no control over these things, you do have control over how you respond and react to them. And there are ways to engage in that that are more resilient, that are healthier, that preserve your body and your psyche better than others. And then finally, okay, we've got all this information and we want to know how to be having this conversation with farmers, how to get information about stress management and taking care of yourself to farmers. So we asked, what are the best ways to get information about stress to farmers and farm communities? Interestingly, social media was number 1. That people also suggested newsletters and magazines, particularly commodity and farm bureau newsletters. They were very interested in classes at the extension offices and website brochures. So you can see, but social media, newsletters, classes, and websites seem to be the number 1. So those are places that we are thinking about as next steps in terms of disseminating information. So farmers and agricultural workers really demonstrate strength and resilience in the face of many challenges and hardships. I don't want this research at all to imply that there's weakness or there's something wrong with farmers and agricultural workers. This is a tremendously resilient group of people who are facing tremendous challenges. And lots of these factors, like the weather, like commodity prices, like farming costs, just exacerbate the stress that's baseline for a farming population. Women are probably experiencing this differently than men, and so we have to think about that in terms of our responses. And there's a good subset of people who aren't confident that they could help somebody under great stress or who are thinking of suicide. And again, I have to put a caveat on that because that's people who think they know what to do. Whether they actually know what research shows is the most effective to do is a whole separate question, and I didn't go there in this survey. But clearly there's more education that needs to be done. But the hopeful, the promising things is that there are so many points of leverage in rural communities that can be used to prevent death by suicide among farmers and agricultural workers. I mentioned some of them before. Another one that's come up when I do this presentation is bankers. ag lenders specifically, and that when a farmer is told he can't get a loan, that's a real time of crisis, and that if we can train ag lenders to recognize the warning flags and to know what to do to make sure that a farmer is safe and gets the help and support that they need, that would be tremendous. So there are lots of promising avenues to reach farmers and farm communities with information on stress management and promoting suicide prevention strategies. As I said before, we're working with our College of Agriculture Extension on this, and the extension agents are doing really clever things in this area that I think just demonstrate that we can do lots of out-of-the-box thinking on this. The extension agents in one of our counties, during their production meetings in January and February, had the local hospital come in and set up a blood pressure screening machine at the back of the room. So farmers could have a free blood pressure check, and while they were getting their blood pressure checked, we could be talking to them about stress and health. And here, give you this packet of information and start the conversation. Because I think the most important conversation in all of this, and the most important thing in all of this, is that we've got to have this conversation. We've got to have it a lot. We've got to have it in the open. We have to destigmatize this and let people know that it's okay to ask for help and that help is available. And one thing that I realized I didn't do on this, and I should have done it as a slide, and perhaps, Philip, this is something that you can share with people later, but I want to give everybody the number for the National Suicide Prevention Lifeline. This is a number that you can call 24/7. It can give you specific information if you're in a crisis. If you have a friend who is in a crisis, you can call and get guidance as to what to do. And it can help connect you with local resources so that you can get help. That number is 1-800-273-8255. And then the last thing I'd like to say is that talking about suicide and this level of stress is not an easy thing. And it can bring up feelings for people. So if you find yourself unsettled after this talk, couple of things. One, know that there's an awful lot that we can do. And two, get support for yourself. Go talk to a friend, do whatever you do to get support, because this is a stressful conversation to have, but it's a tremendously important conversation to have. And I'm really glad that I've had the opportunity today to talk to you about it a little bit. So thank you. And with that, Philip, I'll hand it back to you.
Okay. Well, thank you very much, Anna. I think I speak for everyone that we appreciate this very powerful talk on a very pressing issue with some really great data attached as well. So at this time, of course, as we always do, I'll go ahead and open it up for comments, for questions. Use the chat box to put those questions in, and as you think of them, just write them in, and then Dr. Chayat can answer them as she sees them.
Sure. Okay, so one question, really good. What documents, websites do you recommend we share with growers? They don't know who to call or talk to or what to read. Well, the 1-800 number that I gave you is a really good place to start. But there are other really good resources. If you go to the National Farm Bureau website, they have an initiative called Rural Resilience, and they have lots of reading materials there. If you go to the UGA Extension website and search for Rural Georgia Growing Stronger, we have a page with lots of resources. Everything we have in that booklet that we hand out is there. Both of my studies are there. Links to other national sites are there. So if you go to uga.edu and then just type in extension Rural Georgia Growing Stronger, the page will come up. But I think that's a really good idea to get growers reading ahead of time, and then maybe talking to each other about what they've read. as a way, again, to get this conversation going. Second question, really good. How might the demographics of the cases studied through the VDRS differ from the total ag working population in Georgia? I don't have specific statistics on the total Georgia agricultural working population. The demographics match very closely with nationally what farmers look like, more so farmers than agricultural workers, which I think is part of what you're getting to in the next part of your question, is how much do H2A workers in Georgia contribute to farming numbers and potential percent contribution to the bigger picture. H2A workers are very significant in Georgia. I know this year when there have been all sorts of issues with regard to immigration and concerns and confusions about that, I have had conversations with blueberry farmers, for example, who've said they've had a hard time finding enough workers to pick the crops. So in terms of this bigger picture, though, this isn't really getting captured here because the Hispanic population as shown in this subset is so low. And I don't know what's going on with the Latinx community, and that's another piece of what we need to look at. But I think you're right. I think there are very different sets of issues when you're thinking about a farmer, maybe an agricultural worker who's managing a farm, and a worker who may be a migrant or who may be here on a H2A. So great questions, thank you. Is there anyone doing this research on a national level? USDA is getting very interested in it. They've put out a grant, the acronym is FRSAN, and for the life of me in the moment, I can't remember what that stands for, I apologize. But they're funding rural farmer and rancher stress is the first three letters, but they're funding research in this area. Other people who are doing the research but doing it in their own areas, Michigan State is doing a huge amount of work. There's a lot going on in Minnesota. North Dakota is doing some really great things. USDA seems to be the place that's starting to push the research nationally. And then, as I said before, Farm Bureau is doing stuff. And Farm Bureau and the Farm Credit Union and Michigan State partnered. They just announced this a couple months back. And they've developed training for Farm Bureau agents. They sent out an invitation so every state had a Farm Bureau agent who could come, and it was a train the trainer on identifying mental health issues and risks for suicide and knowing how to do a referral and how to get somebody to help. Next question, Libby, tell us more about the training for agents. There are a couple of different trainings. There is something that's been developed called Mental Health First Aid. And this is something that, again, if you Google mental health first aid, there's a website that comes up. But our State Department of Behavioral Health has people who are trainers in that area. And that's a day-long training that takes away the myths about mental health and mental illness, helps people understand what it is, helps people understand how to recognize it, helps people understand how to be supportive, and then helps people understand how to link folks to services. There is also a really good online training, and for people who are in places where getting to a training might not be feasible, there's and these are all private entities, so this is not a an endorsement commercially, but I've gone through this training and I find it really helpful. It's called QPR, Question, Persuade, Refer. It's a 2-hour online training. It's very inexpensive, and it teaches people how to ask the question, are you thinking about killing yourself? Because that's something we're all scared to do. That's a really uncomfortable conversation to have. And sometimes people are afraid, well, if I ask, I'm going to put the idea in their head. But you're not. If you are picking up enough vibe that you think somebody might be thinking about ending their life, you know that those emotions are there. So this training helps you get comfortable just saying, you look incredibly stressed and like you're having a really, really hard time, and you've said you don't know if you can go on. Are you thinking about killing yourself? And what people have told me is that that question actually is a relief, because it means somebody cares, somebody's noticing, and you can talk about it. So that's the Q. P is the persuade, and that's what you do once somebody says yes until you can get them to treatment, to help. And that's sitting with them, talking about how much you care about them. You don't say, oh, no, 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 you shouldn't do that. But you tell them about how important they are to the world and that you want them in the world, and stay with them until R, referral. You can get them to the local mental health center. You call the 1-800 number and find out where you take them. If all else fails, you take them to the emergency room, and then you follow up afterwards. There's this lovely concept called caring contacts and caring communities, where after somebody goes through something very stressful like this, you reach back out, you circle back out. How are you doing? I'm so glad that you got help. I want to be there for you. And communities can really kind of wrap around people. So that was a very long answer, but QPR online training is another thing that can be helpful for agents or for anybody, actually. Okay, David says he's in Arkansas, a similarly rural, farming heavy state. Can you recommend any sources of data specific to Arkansas? I don't know any, but I think if you go to the National Farm Bureau site, they have some things broken out by state, or they can give you information at the state level. And if you have trouble with finding anything, email me privately. You can just Google my email address and I'll help you look for stuff. Mike asks, if the trend line is up, like I mentioned at the beginning of my talk, how do I explain that? What factors are changing that contribute to farmer stress and suicide? We don't know for certain. And again, those numbers are small, so it's hard to really firmly claim stress, a trend line. But I think there have been some real financial stressors in the past few years. I think there have been larger community stressors that may be impacting farmers. I'm thinking about things like the opioid epidemic, which is just hitting rural areas in general. And while none of these people had a documented opiate issue going on, that can be stressing to an entire community. It's a stressful time we live in. Beyond that, I don't know. I'm going to be very interested to look at the 18 and 19 data and see if post-hurricane something different happens with the pattern. Okay, Glenn says, one barrier in my view to dealing with this issue beyond the availability of healthcare is whether or not farm workers and farm operators have health insurance coverage for mental health. Yes, that is a big issue. I think not having insurance or being underinsured can be a tremendous barrier. I think public mental health centers will treat people on a sliding scale, but there's not a lot of that around. I think telemental health could help some with that. Though, as I said, depending on where you are, broadband's an issue. I think we have to think about building layers in a community to make a community strong, so that for people who are absolutely in crisis, there are services available to them, professional services and counseling services and hospitalization if that's what somebody needs or whatever. But before that, prevention would be great if we could do things earlier. Can we set up support groups? There's a fascinating video on YouTube. Again, if you just Google farmer suicide support group, this farmer who years ago set his barn on fire and walked into it fully intending to die, and then walked back out again. And now his life's mission is getting farmers together to talk among themselves about the stressors that they're experiencing and to provide each other with support. One of the people in the video says, you know, I went to the local mental health center and she was really nice, but she has no idea what farming life is like. She didn't get it. Here with this group of guys, and they meet at what looks like a diner, they get what my life is like and what I'm going through. So we can think about support groups and peer support and things done through the church and this idea of caring communities, and think about a continuum of care, and then advocating that everybody who really needs treatment can get treatment. Absolutely. Okay. Katie asks, is there any grant or other monies for marketing to the growers for awareness, education, and/or to offer places they can go for help? That's a really good question. I've done all of this without any funding, which is one of the great things you can do as a dean. But we are thinking the same questions. And what I am thinking about, and what we've been talking about, is thinking about what entities are there that care about farmers, that do business with farmers, whose success is intertwined with farmers, chemicals, manufacturers, bankers. Do those entities have corporate responsibility foundations that would be willing to fund something like this? Would the local hospital be willing to partner with you to fund something like this? In our rural county where we're piloting some of this, we're really fortunate in that the local hospital, the local extension, the university, a local mental health clinician, the small business entity, we're all pulling together to try and get this information out. So I think even if you don't have monies, you can start pulling a community together to have this conversation and then begin doing the public education and the marketing. But then grants, I think businesses, corporations, foundations, and as I said before, the USDA is starting to fund that, and there's supposed to be another round of FRISAN, FRSAN, grants going out, I was told, this year. That's more for research, but it could be intervention research that could include marketing and public education works. Okay, yes. Libby, thank you. The Farm Bureau, she's putting the website here, fb.org/program/rural-resilience. And there was an article in the Morning Ag Clips this morning, Farm State of Mind campaign to support rural mental health, with a link. The Farm State of Mind, I think, is that training with Michigan State. And let's see. And I think that's it in terms of questions. Are there any others? If not, thank you all. Amazingly great questions. Thank you all for your attention and for giving me the chance to talk about this. I'd invite anybody who thinks of questions later. If you're like me, half an hour later, you'll think of something. Please just shoot me an email. My email is amscheye, my first two initials and the first part of my last name, @uga.edu. And I am more than happy to share whatever resources I have, because this is an important topic and farmers deserve our support and deserve the best of us. So thank you.